Good afternoon, everyone. Thank you for joining us for this live conversation on stroke. May is National Stroke Awareness Month, and according to the CDC, stroke is the leading cause of death in the United States and a major cause of serious disability for adults. But stroke is preventable and treatable. So to discuss the signs, symptoms, and treatment of stroke, we've brought back Dr. Kim Gannon. She's the medical director of the ChristianaCare Stroke Program. Dr. Gannon, thank you for joining us today. Please take a minute to introduce yourself.
Hi, thanks so much for having me back. I am privileged to be the director of the Comprehensive Stroke Center here at Christiana's main campus in Newark, and our primary stroke center at Wilmington Hospital and the Acute Stroke Ready branch at Middletown Emergency Department.
Fantastic. And before we get started, just a reminder to our viewers, if you have any questions for Dr. Gannon, please put them in the comments below in this live stream, and we'll be able to get to your questions during our conversation. I know we have a few that we'll get to in a few minutes. So Dr. Gannon, to start, let's discuss the definition of stroke and if there are different types of stroke.
Perfect. In general, stroke is when there's a disruption in blood flow to the brain. There's two different types of stroke. There's an ischemic stroke, which is where a blood clot travels to one of the blood vessels in the brain and blocks up blood flow for a long enough period of time to cause permanent damage. The other kind of stroke that we hear about is called a hemorrhagic stroke, and that's where blood escapes the blood vessels and causes damage by being in a place where it really shouldn't be. Most types of strokes are going to be that ischemic stroke. About 70% of all strokes are a blood clot kind of stroke.
So we've all heard of FAST. Hopefully we've all heard of FAST. And I know we've done a lot of promotion for that here on the ChristianaCare social media platforms, but talk about what FAST means and those signs and symptoms that we should be looking for.
FAST is the acronym that's put out by the American Heart Association, so we can keep the signs and symptoms of stroke really at the top of our mind. The medical community has done a great job advertising what to do in the setting of a heart attack. For example, if you had a family member with chest pain, what would you do?
Call 911.
Right, exactly. We need to get to that same point of that immediate knowledge for stroke. And one of the biggest things is being able to quickly recognize the signs and symptoms of stroke. So the acronym of FAST stands for face, arm, speech, and time. So what that means is if you have a family member, friend, colleague, somebody that you see at the coffee shop that develops a quick onset of facial weakness or drooping of one side of their face, difficulty speaking or difficulty understanding other people, if they have weakness of their arm, then it's time to call 911. There's a couple of other signs and symptoms of stroke. Two that I'll call out in particular are balance. If a person is not able to walk correctly or they feel like they're spinning in a circle. And then eyes is the other one. If they have vision difficulty, like they lose vision in one eye, or they can't see over to one side of the world altogether, those can all be signs and symptoms of stroke. So keeping those in mind to be FAST, BE for balance and eyes, and then FAST, FAST for face, arm, speech, time. Those are the things that can help us recognize signs and symptoms of stroke really quickly. And then exactly like you said, for chest pain, we want to call 911 immediately if we see any signs or symptoms of stroke.
And do you see a difference in the signs and symptoms between men and women?
That's a great question. So most of the time, all of our brains are relatively similar between the two sexes. However, there are a couple of times when women's symptoms can be a little bit more tricky. Sometimes women will just feel a little bit off, and sometimes women have a tendency to delay symptoms, maybe it's going to get better, let me see if I can just shake it off for a little while, my life is busy, have that sort of attitude. Sometimes women's symptoms can be a little bit more subtle. We want to make sure that people are taking all of these signs and symptoms very seriously. People recognize something that's different in their own body much better than somebody externally. So we want to make sure that folks are attuned to, if you feel different, really escalating that quickly. If you're feeling off balance, if you're feeling dizzy, if you're just not feeling 100% yourself, like you can engage in conversation as much as you usually can, or as you're as quick as you're on your feet as you usually would be, those can be some of the more subtle signs and symptoms of stroke in women to be on the lookout for in particular.
And is there a specific population that is at a higher risk of stroke?
So anybody across the whole age demographic can have a stroke, and there's strokes for lots of different reasons. We know that our older population above the age of 65 is at a higher risk of stroke compared to younger population. And above the age of 80, the risk of women having a stroke actually outweighs that of men. One of those reasons is just because women live longer than men, and the age of an initial stroke in women is about 4 years after that of men. So looking out for our elderly population, our friends and family members in that age range, those are the things that we want to look out for in particular. Younger people can actually have stroke also, and that can be because of a couple of different things. Sometimes the most common thing we see in the young population is after a traumatic injury, like a car accident or a motorcycle crash, something where you had quick movement of your neck that can tear the blood vessels in your neck, which can lead to blood clots that can travel to your brain and have a stroke. So in the younger population, being conscious of these things isn't something that we think about as often as we do in our elderly friends, but we want to make sure that we're paying attention to it in anybody across the population age range.
And are there other lifestyle factors we should be keeping in mind? Smoking, drinking, exercise?
Yeah, exactly. So the best thing we can do for stroke is prevent it. I would love to not have as many stroke patients here. While I'm proud of our team and we do a great job of treating stroke, we would love to not treat as many strokes. And one of the things we can do is to prevent this with lifestyle modifications. Some things we can't change. We can't change our family background. We can't change our genetic makeup. But the things that we can intervene on are just what you said. And we've heard a lot of these things preached to us over the course of the years, making sure that we're eating a healthy diet, getting exercise, stopping smoking, and that can be really challenging. Sometimes it can be just little things that we can change to start working these lifestyle modifications into our daily habits. So when I think about exercise, if someone is not engaged in exercise on a daily basis, maybe that means just parking at the back of their workplace and walking in from the parking lot. Maybe that means taking an after dinner walk with your family or your pet, or taking the elevator up to almost the floor where you work on and taking the stairs that last flight. Those are some of the things where you can start to incorporate exercise into your daily routine. And then you mentioned smoking also. Since sometimes in the 80s, we've all been recommended to stop smoking, but it's still really hard to actually do. What I tell my patients is if you can stop smoking, it actually cuts your stroke risk in half. And that's better than any medication I can prescribe to you. Just doing that one lifestyle modification is such a significant benefit to your health and reduces your risk of stroke more than anything else that we could provide for you.
Wow, that is significant and something people should keep in mind. Absolutely. We do have our first submitted question. The question is, I know someone who has had a mini stroke. What is that?
That's a great question. So mini stroke is a term that's kind of thrown around in our population, but it's not really what we would call it from the neurology side. So I take every stroke just as seriously as the next. Sometimes what people mean when they're calling a mini stroke is what's really called a transient ischemic attack. And that's where a blood clot is trying to block up a blood vessel, but it goes away before it leaves any permanent damage. The reason why it's important for patients to take these symptoms seriously, even if their symptoms come and go relatively quickly, is we need to find out why those symptoms started. The reason is before I know why the patient had those symptoms, I don't know what other risk factors they may have or other interventions that we could provide to prevent them from having that permanent disability or that large stroke. So it's really important that we take these episodes of transient sensory changes, transient weakness on one side, just as seriously as permanent disability, because they can lead up to a larger stroke with permanent disability.
So we have two submitted questions that talk about our program, but before we get into those questions, take a minute to talk about how we treat stroke here at ChristianaCare.
So we treat a lot of stroke and we treat stroke quickly. ChristianaCare is recognized as one of the national leaders for quality and safety. We've been recognized by the Joint Commission and other organizational bodies, including the American Heart Association. Just this past year, actually, despite the challenges of COVID, we were able to be awarded the top 4 honors by the American Heart Association for stroke care. That means that not only do we know that we do a good job, but it's being recognized by other accrediting institutions also. Here at ChristianaCare, we have everything that you would need to treat acute stroke. That means we have an exceptional emergency department team that's very good at recognizing stroke. We have all of the imaging facilities, CAT scans and MRIs that we need acutely to treat patients. We have the vascular neurology stroke team, the neurocritical care team, the neurointerventional surgery team, and neurosurgeons on our team. You have the whole gamut of people and facilities that you need to treat an acute stroke. What happens here at Christiana is once an acute stroke is recognized, the patient is seen by a lot of people at one time, and we have multiple options for how to treat acute stroke. Back 15 or 20 years ago, we didn't have anything to do besides start rehabilitating patients, but now we have multiple options. One of those is IV medication. If patients can get to us quickly, we can provide them something called a thrombolytic medication. And what this is a clot busting medication to break up that blood clot that's blocking up blood flow, causing those stroke symptoms. Sometimes patients are a candidate for that, but sometimes for reasons they aren't able to get that. But we have another option now that's just come on board in the past decade. It's called mechanical thrombectomy, where we can actually physically retrieve the blood clot that's blocking up blood flow. We have 4 exceptional neurointerventional surgeons on our team who do this more than 200 times a year. So we provide a high volume and a lot of expertise to treat these patients as quickly as possible.
You do have an incredibly impressive team. We have 2 submitted questions that will talk more about your team. One is, does the comprehensive stroke program include behavioral health services?
That's a great question. It's really important to be in tune to our mental health, not only just our physical health, and stroke can definitely play a role in this. Anytime you have a large lifestyle change, something that you weren't expecting happens to you, behavioral health can be really important. And here at ChristianaCare, we do have access to psychiatrists and psychologists who can help our patients with this coping process. It's really difficult, especially in the early days, to adjust to these changes in your life. Behavioral health can be helpful to the patients, and sometimes it can be even helpful to the caregivers and the family members who are helping that patient adjust. So sometimes it can be a family affair and not just focused on that patient individually.
Absolutely. Our next question has to do with how the family can continue to help that patient. This person asks, what are exercises families can do with stroke patients while visiting them in rehab? This person wants to be involved when visiting their loved one in rehab.
I love that. The more family engagement we can have, the more community engagement we can have for our stroke patients. Really, that is key to their recovery. And getting our patients into that rehab is excellent first step. And having the family and friends engage is really important. Sometimes for patients in rehab, that just means having a conversation. If the patient's difficulty is speech, just having a conversation or talking to the patient if they can't yet speak with you can be really helpful. If the weakness is maybe in a hand, you can use one of these stress balls. I happen to have one here on my desk, and just having the patient practice squeezing that can be really helpful during the downtime during that rehab stay. Even little things like having people tap their fingers together can be helpful just to kind of continue that movement in between the therapy sessions. Rehab stays can be really busy, so we want our patients to make sure that they're getting sufficient rest during rehab as well. So having them exercise 24 hours a day may not be the best thing, but if you need to fill a few gaps, doing some of those simple exercises, continuing in conversation, and just working on their thinking and memory skills can be really helpful.
And Dr. Gannon, this next submitted question, I think, takes us back to talking about the signs and symptoms. This asks, how much pain does someone have when they're having a stroke?
That's an excellent question. And that can be different between the ischemic kind of stroke where you have the blood clot and the bleeding kind of stroke where you have the blood escaping the blood vessels. Most of the time, an ischemic stroke doesn't cause any pain, but about 10 to 15% of the time it can. Usually patients who are having an ischemic kind of stroke, they just complain of like a headache, nothing that is too out of the ordinary, but the bleeding kind of stroke can be a really significant headache. The take-home message from that is that not all strokes cause pain. Some strokes do, and you want to take it very seriously, but not to delay medical care just because you don't have any pain. For example, high blood pressure doesn't hurt, but it's a very serious medical problem that we want to stay on top of.
And if someone is watching this thinking, I know a loved one who has been exhibiting some of these symptoms, or sometimes I'm ignoring symptoms that may be stroke related, what should they do?
Any of these signs and symptoms, 911, come straight to the nearest emergency room. You don't want to delay your care. You don't want to take a nap and see if it goes away. You don't want to take extra medications at home before you come in. You don't want to call your primary care doc because it's going to take a little bit of time for them to call you back. You want to dial 911 and come straight to the nearest emergency room. The reason that's really important from a stroke standpoint is the faster our patients can get to us, the faster we can care for them. In neurology, we like to say time is brain, which means that the quicker that we can restore that blood flow appropriately to the brain, the better outcomes our patients are going to have long term. Every minute that goes by where we're limiting blood flow to the brain causes weeks to years of damage to the brain tissue itself. So really having patients come in as soon as they recognize the signs and symptoms is the best way for us to provide treatment.
So Dr. Gannon, no one wants to contact your team. No one obviously wants to have a stroke, wants their loved one to be in this situation, but your team is, the best of the best for those who have to see you. So how can someone find more information about the incredible work of our stroke program?
So one of the ways you can find more information is on our website. I think that we'll get you guys the link to put in the comments section or on the slide deck. We can have information on our website. We have information on you got the Christiana Maine Facebook page. And then if you need to call our office, we can put the information to contact our team there also.
Absolutely. All of that information is in the comments below in this Facebook Live. So check there for links to our website for more information. Dr. Gannon, thank you so much for your time and have a great afternoon.
Great. Thanks for letting me join you. Take care.